How do you prevent a second stroke? One of the first things that you should ask your physician if you've had a stroke, and one of the things that a rehabilitation physician or your primary care physician ought to be thinking about after you've had a stroke is, how do I prevent a second stroke or the next stroke if you've had more than one stroke? First question that needs to be answered is, why did you have the stroke in the first place? So we can't ignore that, because that may lead us to exactly what we can do to try and prevent another one. If you were in atrial fibrillation, had an abnormal heart rhythm, well, then it's pretty clear that we're going to put you on anticoagulation. But other types of strokes need other types of treatment. So that's your first question to answer. The other one to ask is, are you on the best medication to prevent another stroke? Or if you're a healthcare provider or a physician watching this video, is my patient on the best medication to prevent another stroke? Were you on aspirin already? Was your patient on aspirin already? And do I need to consider something else? So aspirin is first-line therapy, and I won't get into dose. It can be somewhat of a matter of opinion. Most people are happy with low-dose aspirin. Clopidogrel, which is an antiplatelet agent, and then warfarin, which is a much stronger, misnomer is it's a blood thinner, but it's an anticoagulant. And then for prevention, unless we're dealing with atrial fibrillation, we won't talk about the novel anticoagulants, the new drugs. Interestingly enough, one of the most important things is taking your medication. You'd be surprised how many times you really find out that the patient isn't accurately taking their medication for diabetes, isn't tightly controlling their blood pressure, isn't tightly controlling their diabetes or their cholesterol. And we have fabulous medications now for controlling diabetes, hypertension, and high cholesterol. So we may need tighter control. You thought you were getting away with it and it was okay, but now we really want to prevent that second stroke. How's your diet? Do you need to lose weight? All right, you're following a good, healthy diet. You can't stress enough that if you smoke, you need to stop. And odds are with you, really, that if you change these habits, these life habits, that we can work hard together to prevent that second stroke.